Hello, everyone. So, in this session this afternoon, we are going to be talking about how acupuncture can help you with sciatica. In our studio today, we have Dr. Trottier. She is a licensed acupuncturist and doctorate in Chinese medicine. She is joining us live from San Diego right now. Welcome, Dr. Trottier.
Thank you. It's nice to be here.
Thanks a lot. So let's understand, before we go into what acupuncture can do, let's understand what exactly is sciatica and why does it happen?
Okay, so sciatica happens usually stemming from a low back problem. The sciatic nerve starts in the low back, usually around L2, L3. It splits on the side, the spine. It goes to the side, goes through the glutes, and it goes down the legs all the way down to the feet. So usually it's one-sided. It can be pinching of the nerve or problem at the nerve on the left side or the right side. It can happen at the back. It can happen in the glutes. It can happen in the leg. And what people will experience is some pain. They can have nerve problems like numbness, tingling, needles, things like that.
So is it like if I'm lifting some like a heavy weight? Is that how it will happen, or is it as a result of something more serious ailment?
A lot of patients develop sciatica just exactly how you said, picking up bags of groceries or overdoing it in their weight training. A lot of my patients also develop sciatica from just sitting with incorrect posture at work or in their car for long periods of time.
So is it age related? Like if someone is over 40, would that be more prone? They are more prone to sciatica versus young people?
Well, generally I do see people in middle age developing sciatica faster, but that's usually because of years of poor posture. I do have patients, I think my youngest patient with sciatica was probably 12. Pregnant women easily develop sciatica just because of the changing of their pelvic structure during pregnancy can press on that nerve. So it's not age related, but generally older people will struggle with this more than younger people. They're just not as active and have as good of circulation.
So let's say someone's developed sciatica, right? And now they're going to have problem in walking, right? Because pinching of the nerve and it's be hard to walk. That's what I'm thinking.
Yes, they will have problems with walking, going up and down stairs. A lot of patients report trouble sleeping, especially rolling over in bed at night. They'll have excruciating pain sometimes. Sitting for long periods of time, standing for long periods of time, anything that's going to happen around the low back legs can aggravate the sciatic nerve.
Wow. So that can prolong for months or days, or what is the duration?
Sometimes people will feel it for a few days to begin with, and then it can work itself out, and then they might get it for a few months, and then some people will have this problem for years if they don't get some kind of intervention.
Okay, so let's come to acupuncture. How does acupuncture help?
Sure. So acupuncture works by stimulating the body's own healing mechanisms. What will happen is it will help decrease inflammation in that area. It can help with circulation to the nerve. It can help with sending some responses to the brain that will lower the pain response. And over time, your body will start to heal that area and you will not have pain anymore.
So is it like localized acupuncture or distant acupuncture?
So it just depends on the practitioner you go to see. Some people will use a local treatment, which means they will be putting needles in the site where there is pain or where the problem is stemming from. I actually practice a distal type of acupuncture. That means I don't put needles near the site of the problem or where you have the pain. I really like this style because if you tell me I only have this pain when I lift my leg, then I can put needles somewhere else and we can see you lift your leg pain-free while you're getting treatment, and then I know my treatment's working.
So is it like you're putting the needles that's connecting that particular leg, right? I mean, like let's say my right leg, and you will put needles here. I mean, I'm just thinking, yeah.
I could use your shoulder, your arm, your hands, your head, your feet, your other leg. There's a lot of different areas I can use in the style that I practice to help the body balance itself.
So what other things, like would you also use cupping, moxibustion, electroacupuncture? What are the other tools?
So primarily, most of my patients start with simple acupuncture. If it's warranted, I will include cupping in their treatment. I usually have patients do moxibustion at home. I teach them how to self-administer that, and they can do that at home, again, if that is needed.
And what about Chinese formulas?
Yes, I do include herbal medicine in my treatments. But again, generally I start with acupuncture and like to see people get better with that before I add on other modalities.
So can you talk about any acupressure points that people can do? Let's say someone has a sciatica and they're having so much problem walking, right? They're going to have to walk, sit in the car, drive and go to an acupuncture. But is there something they can do at home to at least give themselves, just temporary relief?
Sure. I can give you 3 places you can try to massage on yourself to help relieve your sciatica pain. If your sciatica pain is on the right side, for example, you can use your left hand or left shoulder. So on the hand, you'll find this area, this fleshy area between the first finger, your index finger, and your thumb. And you might find some tender points along the bone here. You can massage that and start moving your back around, your hip around, see if you get some pain relief. The other 2 spots are in the shoulder. Again, it's going to be the opposite shoulder from where you have the pain. You can just reach behind and you might find some tender spots along the scapula. Again, you can just massage those and move your hip around, move your leg around, see if that relieves the pain. So you can find that on the back of your shoulder. And again, you can also find it on the front of your shoulder. So right where the fleshy part meets the bone in your upper arm, okay, there might be some tender spots there. So I would say of those 3, whichever is more tender, that is where you'll probably want to focus on. And you don't have to press too hard, just get some circulation in that area. And again, if you're massaging that and moving the affected area, you should start to feel some pain relief.
Oh, wow. And what about any topical, applications like oils, Chinese oils or herbal oils or anything like that?
We do have a lot of herbal liniments that we use in my practice. Again, just like herbal medicine and just like acupuncture, there isn't a one-size-fits-all. I usually like to see the patient and diagnose whether it's a hot condition, a cold condition, and use the appropriate type of liniment and the appropriate herbs. But a lot of the liniments and even over-the-counter have menthol and camphor in them, and those are usually pain-relieving herbs. So if you find something like that, you can try that. Otherwise, you can consult with me or another licensed acupuncturist on what will be the best formula for you.
Sure. And then let's say someone has sciatica. How many sessions, I should say, that typically on an average you go through before they start feeling relief?
So in my practice, generally people will feel relief right away. Within 30 to 60 seconds of putting in the needles, they should feel a change in their condition, and usually it's relief. How long that lasts depends on the condition, depends on the health and constitution of the patient. Some patients will get relief for 1 to 2 hours after treatment for the first few treatments. Some will get a couple days, and that will be a good gauge about how many treatments you'll need and how frequently you'll need to come in. So most of my patients, if they're having a high level of pain, they've made it into my office, are going to need to come in 2 to 3 times a week in the beginning phase of treatment. If this condition has been going on longer than 2 months, you're probably going to do 2 times a week for at least 3 weeks. If it's been going on for many months or a couple years, you can expect to be coming in for at least 20 treatments, if not 40. I like to see patients more frequently in the beginning, so we see them 2 to 3 times a week. As they get better and their results start lasting longer, we stretch out the treatments to once a week, every 10 days, every 2 weeks, once a month until they graduate and they're pain-free.
Wow. Amazing. I think I'm amazed at what acupuncture can help with. It's absolutely amazing. Anything else you'd like to add before we wrap up today?
I just really think that sciatica is one of those things that is definitely treatable. Acupuncture will certainly help you heal, but it is very important to learn how to move correctly and to get your posture right. So I always teach my patients how to stand correctly, how to sit correctly, how to do their exercises correctly, so that this doesn't become a chronic, reoccurring problem.
Sure. So posture, the way, and we've been sitting, all of us have been sitting at home, right, for the last 1.5 years working.
Yes.
So, and I'm sure you've seen a surge in sciatica patients probably in your clinic over the last 1.5 years.
Yes.
So the message is to learn to have a correct posture so that we do not get sciatica.
Yeah, the whole basis of my whole practice is helping people live happier and healthier lives and learning that they really do have the power to heal themselves. So acupuncture is just one way to tap into your body's own self-healing mechanisms. And then just with my expertise and practice, I really guide people on how to get those results to last longer.
Well, thank you so much. Thank you so much, Dr. Trottier, for being with us. To all the viewers, we've been talking about how acupuncture can help you give relief to your sciatica pain. With that, thank you.
Thank you so much.